From allergies to zinc deficiencies, hangry to hay fever, we provide easy-to-absorb information to improve your health. It sounds like health on Texas A&M Health Talk. Howdy, this is Mary Lee Meyer.
And I'm our co-host, Sam Kraft.
And welcome to Sounds Like Health. We are here with the wonderful Dr. Cindy Weston. Not only is she a family nurse practitioner, but she's also an assistant professor and the Associate Dean for Clinical and Outreach Affairs at the Texas A&M College of Nursing. She's going to speak with us today about the flu. Welcome.
Thank you. I'm glad to be here.
We're very happy to have you. Thanks for taking time out to come see us.
It's my pleasure. I'm always willing to talk about a topic that has to do with health and promoting health.
Great.
Is it too late to do this podcast? Or
No.
are we still in primetime flu season?
Yes, actually, flu season has not fully hit our area yet. We're seeing a few sporadic cases, but the big season is still yet to come. So it's still a great topic.
How long is like the flu season, I guess? You know, it's like, I'm doing air quotes, but I mean, how long? I've always heard it's like October to like March. Is that the main time? Can you get flu in the summer? Is that because it's a disease? It's floating around, right?
I always think it's a winter.
Isn't it? It's like a cold thing. Is that?
Yeah. Everybody's right. The peak season is October to March. If you look at Texas data and really U.S. data, we usually peak right around the Christmas holiday season. Sometimes we'll peak again around spring break. But you can get flu all year long. And in fact, we typically see cases in the summer, a few cases. It seems like it's more influenza B that we see in the summer, and it's influenza A predominantly in the winter. But we see both really all year long. They just become more epidemic during that October to March timeframe.
And is that because people are coughing and sharing germs more because it's cold and they're getting colds? Why do you think it's more winter-based than it is summer-based, I guess?
Seasonal patterns. It seems to start in the east, the new flu strain viruses, and they move from east to west, and they typically will hit in our winter with new mutations of the virus. So that's why our season seems to peak in the winter, October to March timeframe. The northern hemisphere, that's our winter. The southern hemisphere will experience that usually in the months that is typically our summer.
And so when would you get when is the ideal time for the flu shot?
As soon as it's available is it really when you should get it. But it's going to take 2 weeks to become fully effective and to have the antibodies, and then it's going to last for about 6 months. So knowing that we oftentimes peak again in March, October in our area is generally the recommended month to get the vaccine. But you should get it at any time that it's available.
Well, how do you know? I know you talk about strands of the flu. I mean, how do you know that this flu shot will protect me against this strand? Someone who's not medically based like myself, I don't understand the different strands. Is there a different strand every year? How does that work in the disease world?
Yeah, that's a great question. So the flu, you'll hear this said, the only thing predictable about influenza is that it's unpredictable. It continues to mutate and it changes. It's a virus that continues to evolve. And they base our current vaccine for our season. The decision is made around January of the year, knowing that the flu season is not going to come, or the vaccine is not going to be available until
I don't want to say
September.
they're just guessing, but I know there's a lot of science research behind that. But it's really just kind of like a 50-50 shot, or it's still effective, just not as much as if it was per strand. Is that how that works?
So they look at the patterns that are happening in the East. So really the Eastern countries, Asia, Australia, and make predictions on what the patterns are going to be for our current flu season. And then our group makes that decision around January for that vaccine to go into production in the spring and summer so that we have it available to start administering September, October for our flu season.
So it is a prediction. Is that why sometimes you can get the flu shot but still get the flu?
Yeah. So
Well, it happened to me. I mean, I was very anti-flu shot for a long time. And then one time I got the flu and I swore never again would I'd never have another flu shot because I'm sorry, I wouldn't go a year without a flu shot. And I've always heard that obviously you still get the flu, but it's not as bad. Is that how it works?
That's exactly right. So even if it didn't cover the exact strain, so what we saw from last year was a bad season, 2017.
Yeah, it was awful.
And we knew that 2017 was going to be a bad season based off of what was happening in Australia of that year. Australia was having a terrible season, so we were raising the alarm in August and saying we really need to be vigilant this flu season. It looks like bad based off of what's happening there. What happened was, if you recall, that vaccine did not appear very effective against the strain that actually made it the influenza A strain, and it was H2N3. And looking at that pattern of the H2N3 that the vaccine covered and the strain that actually was circulating in our communities, the vaccine for this year, 2018, has been adjusted to match what we saw last season. So the vaccine changes every year to match what the strain looks like.
Yeah, I just don't think people realize that's what's happening with it.
But it was a good point that you said that even if the vaccine doesn't cover the exact strain, if you do catch the flu and you receive the flu vaccine, it is a milder case.
Sure.
And we did see that people that were vaccinated had a much milder case than those who received no vaccine at all. It was a bad season. I saw people running a fever of 103 on day 9 into the virus. It was bad.
Well, and then there were a lot of flu deaths last year too. I mean, and I guess I don't really know the numbers on how many people get the flu shot and, Lord forbid, or die afterwards from the flu. But is that, I know it's a real thing, but are those numbers, is there a number to compare from those who don't and do get the flu shot? I was just curious.
But isn't it normally either already ill people or vulnerable people that typically die from the flu?
Yeah, so that's a really good point, Marilee. It's the very young, the very old, and pregnant women are who die from influenza.
Flu is called influenza. Is that what?
Yeah.
That's the tail end of it?
Yeah.
Okay.
Yeah. Uh-huh.
No,
Yeah.
I did not know that.
I didn't either. That's why I asked. I mean, it makes me just influenza, like that flu, that's where it comes from.
It's one of those things that makes perfect sense.
Yeah, no, again, we were sitting here talking about it. I just clicked right then. I heard it, and I was like, wait a minute. Let's ask about this. What is the technical term for influenza or the flu? Like, what differentiates it from a cold and the flu? I mean, because I've had both. I know a cold, and the flu is, like, devastating.
Yeah.
They have
You're
similar
achy.
symptoms, too. Everyone always walks in to work and say, oh, I just had the flu.
Yeah.
But if they were gone a day or two, it's probably not the flu.
You should go home, just in case.
So how do you know that you have the flu? How do you know that it's not just going to go away over the weekend?
Yeah, well, usually there's some distinctions and there's a lot of similarities. The distinctions are the influenza, true flu, will hit you like a ton of bricks. It's a sudden onset. I was feeling good at lunch. At 2 o'clock this afternoon, I feel like I got run over by a train.
It is so true. It is just that fast, too.
Yeah. And high fevers, which you can run fever with a cold. And we've had a pretty bad just cold virus in our community recently. And I've been seeing people with 102 fever.
Sure.
And so you can run high fevers with a cold. But a cold will generally come on a little gradually. Like you feel tired and achy one day. You have a little bit of runny nose. You have a sore throat the next day. The next day you develop a cough. With the flu, it's like sudden onset. And you have a fever. You ache all over. You have a sore throat. You have a cough. You have all this mucus. In fact, that's influenza is an orthomyxovirus, and ortho means straight, and myxo means mucus. It's straight mucus virus, literally.
So awful when you say it like that. Oh, gross.
And it causes an overwhelming response for some reason with the immune system. And that's what the deaths are attributed to, a condition that's called a cytokine storm. It's like the immune system goes into overdrive. If your house was getting broken into, you would want the police to show up, but you wouldn't want them to necessarily send the SWAT team who would surround your house and blast it with all the guns, knocking down the walls. you just want some support. And that's kind of a cytokine storm. It's like an overreaction to the threat that is there. And that's oftentimes what leads to death.
Your immune system is actually killing you in that instance.
Well, it deregulates. That virus deregulates it.
Okay.
Yeah, exactly.
It just throws everything off, and it's just downhill from there.
Yeah.
So what do you do when you get hit by the train?
Yeah, so the key thing is to seek medical attention quickly, because there is the option for antiviral treatment, but it should be started within 48 hours of the onset of symptoms. And there are several treatment options available. They have some side effects, so it should be something that you talk to your healthcare provider about and see if it's an appropriate choice for you. But certainly the studies have shown, and a lot of good data came out of the most recent pandemic, which was the 2009 H1N1 pandemic that we saw, the flu. That data showed that people who had received antiviral therapy had lower mortalities and less severity. So we know that it did save lives during that time, and so it's an option, but it should be started early.
But that treatment isn't a cure, right?
No.
Okay.
Yeah.
Was it just kind of like it's like putting cough drops to a cold or something like that, or?
It's a little bit more than that. So we know it shortens the duration of the flu, and the hope is that it obviously lowers mortality and that lessens the severity.
How many people die from the flu on average a year?
Up to 56,000 in the U.S. alone.
56,000?
In the U.S. alone.
I thought you were just going to say up to 56.
Well, yeah, no, that's 5,600 maybe.
Came in.
56,000.
Yeah.
Worldwide, do you know those numbers?
Like up to 300,000
Oh, my
worldwide.
God.
250 to 300,000 worldwide.
Is there a test for the flu?
Yeah. So there's a different PCR tests. There's some rapid tests that can tell you if you have influenza. They can even break it down, influenza A versus influenza B. Influenza A seems to be the more virulent strains, but both
Is there a different
serious.
treatment for either one, or is it the same treatment either way?
The current medications that are recommended cover both strains. There are some older pharmacologic agents that only covered influenza A. So when you look at the flu virus, the electron microscope, it has these neuraminidase receptors and hemagglutinin receptors. So that's the H is the number of hemagglutinin, and the N is the number of the neuraminidase receptors. So that they're a neuraminidase inhibitor. So what they do is the neuraminidase is how the virus sort of transmits out of a cell. So viruses, go into a cell, and they basically turn your cells into virus factories, and it replicates and replicates and replicates and just takes over. And so that shuts down the process of that virus being able to transfer
This is some of the
a
stuff that's
neuraminidase
available
inhibitor.
from the store, just in a hurry. If
It's a prescription.
Okay, it's prescription based. So if you had that, I guess prescription, so a doctor would have to. You
Or a nurse practitioner.
Yes, I'm sorry. Yes, you're correct. Anybody like that could prescribe that to you or get you on the right track for that.
Are there any over-the-counter medications or any symptom management type of things we can get?
Marilee, that is a great question. So for people that are maybe outside of that 48-hour window and they're not in a high-risk category, so a pharmacologic prescription agent is not ideal for them. Then there are supportive therapies that, and there are even some additional prescriptive therapies that may help them, because really the shift changes to symptomatic management of the flu. So yes, there are agents, and there was a really interesting NIH study that showed elderberry syrup.
What is elderberry syrup?
Sounds like it'll go in a potion.
Right? Some sort of, or like pancakes? That sounds amazing.
That elderberry syrup can actually treat the flu and actually potentially prevent influenza. So last year you couldn't find elderberries. You couldn't find elderberry syrup during the peak of the flu outbreak.
And you said an interesting thing there, systematic management. Is that
symptomatic?
Okay,
symptomatic.
So you have the flu, like you have the flu.
Yeah.
What do you do? Like what at that point? How do you treat yourself? I mean, you got the meds from the doctor. Okay, is that the only course that you have, or are there from FNP? Are there anything in your history that you've seen that would, I don't want to call them, urban legends or myths or whatever, but is there anything that that works outside of medication that you can do to help yourself?
Yeah, so fluids.
Fluids?
Fluids are key. So, usually you don't feel like eating when you have the flu, but you almost have to think of fluids as medication. You've got to stay well hydrated. Water, diluted Gatorade, clear sodas, but stay well hydrated during the time that you're battling influenza. Fever management with Tylenol or ibuprofen in appropriate doses, and almost scheduling that'll help you feel a little bit better. It'll manage that temperature. Over-the-counter medications like decongestants, if they're appropriate, mucolytics like guaifenesin, nasal steroids can help open up and decrease the risk of a secondary sinusitis related to influenza. The nasal saline rinses for all that mucus.
Do you ever see, and again, this is I'm sure this does happen, do you ever see flu advance to other things like pneumonia or, can the flu jump like that?
Yes.
Your immune system is so weak already when the flu, but what's the most common thing it could transform into?
You hit the nail on the head, Sam. That's it, is pneumonia. It can go into a respiratory distress syndrome. It can lead to other infections, sinusitis. And oftentimes it's the pneumonia or the overwhelming infections. It can lead to multi-organ system dysfunction. Those are the things that usually people die from, and oftentimes those things are a complication of that cytokine storm.
So scary. It starts off a cold.
And
well, not a cold. Starts off as the flu.
That's right.
Fair enough. Fair enough.
Very good.
I'm going to recommend a podcast for you to listen to.
No, okay, so that's a good point, too, that you brought up. Have you ever had the flu?
I don't know if I have.
Oh, bless you.
Actually.
Be so happy.
I haven't gotten my flu shot yet.
You haven't got
well,
your
we
flu.
need to get one for you, Mary
I
Lee.
know. I was joking about getting it live on the air. And I was
How awesome would that be?
Go. No, I am the worst.
Are you scared of it? Or no, I guess that's one of our points here. Why are you scared of the flu shot?
The buildup.
Really?
I know it's going to hurt. I know I have to sit down in the cold chair and someone has to clean off my
it's that cold
really
alcohol
big bicep, and it's going to be sore after. And
that's that's a great point. Why is your arm sore after you get the flu shot? I've always heard it's because you're getting injected with the virus, and you are.
I heard it's because you tense up.
No, that's not. Is that what it is?
I think it could be a variety of reasons.
So there's not an actual medical thing, because I've always heard it's the virus entering your body, and that's what makes your arm sore. And I always thought that was kind of cheesy. Is that?
I don't.
Is there a medical explanation for that?
I don't think that would be the medical explanation for it.
In her face, she's like, "This guy's crazy. I don't know what he's talking about."
Some things that could lessen or to help if you're real worried about the soreness is, and we do this with children, is put some
That's
ice.
how you need to treat me. I need to be a child.
You can put ice over the site for a few minutes ahead of time, and it really does help to numb it a little bit.
Yeah, there you go.
It works with children. There's these cute little devices that are ice packs, and they actually kind of vibrate, and we use them right before the injection.
I might actually look
helps.
into that. If you ask my parents or even my pediatrician growing up, I'm pretty sure there was a star by my name.
You were the asterisk.
I was the kid. There was one moment I was way too old, but then they started to give me any vaccines in the back, not even in a room.
So you wouldn't frighten
it
the
was
other children.
in the far back hallway.
You were the
in the
crazy
storage
kid?
closet they took me.
You were the kid that was being murdered in the back room?
And I think at one point I was like, they need to know. The kids need to know what they're going to get into.
Well, for me, the needle doesn't bother me. The poke didn't bother me. The stabbing motion is what bothers me.
It was the whole experience.
And it's so weird. I don't know. But I could see where that would be.
So Sam has a young kid. So
yes, a 3-year-old.
That cannot be.
Who has not had his flu shot yet.
Oh.
We should go together.
Yes.
So speaking of small
scarred.
children, my Archer, his name's Archer. He's 3. When he was really small, I say a year, maybe less, or 2 years. What's the earliest a child can get a flu shot? And a flu shot meaning, I think we did the spray. Is that what it was, or what are the options for a small child?
Yeah. So great question. So your first question was what age? It should start at 6 months of age.
6 months. Wow.
6 months. And 6 months up until any age should have the influenza vaccine. The very first time that they ever receive the vaccine, they should receive a second dose a month later.
Yes, and we did that. Is that just... can you explain that process? I didn't understand exactly.
It's a boost to the immune system. And now after that first time where they have the first dose and 1 month later the second dose, every year after that, just one vaccine.
Okay.
And now it was taken off the market for a couple of years, but it's back this year, is the nasal spray, which is a live virus. Now, the injection is an inactivated virus. It's not live. It's really just those components of that H and that N to boost the immune system to attack the virus. But the influenza nasal spray is live, and that can only be given from ages 2 up to 49.
Really? Well, that's still a pretty good range, though.
Yeah. And
dumb question. The live virus, if it gets, could someone catch the flu from this? Really?
So a mild case of influenza, so it's not recommended to use the live virus for pregnant women or for anyone that's in a home with someone who's immunosuppressed. Someone immunosuppressed should not receive the live virus, or if they're living in a home with someone who's immunosuppressed.
So is it kind of like how you try to get the chicken pox when you can manage it? So I'll try and get the baby flu now.
Baby flu like that.
And boost the immune system. So similar, and for children that are really afraid of needles, it's an option. It was actually not recommended for 2 years because it was not shown to have the same efficacy as the injectable vaccine. So it was not given, and I think the decision was to bring it back on the market because there are some people who are within that age range that just were not going to get the vaccine at all, get vaccinated at all without the option of the live virus. So better something than nothing.
Mary Lee.
I heard it was recommended for Mary Lee's.
Seriously, get your flu shot.
No, I will. I
Do
will.
it.
I've been meaning to for the past few months. I've been busy.
I know. Time gets away.
Washing my
You
hair.
can go to CVS. You can go to any local. I think all the local pharmacies have them. Is that right?
Yeah.
Well, there was a period of time where I was without insurance. But so the flu shot is covered on normal insurances. Because we'll pretend
what's the
that's why.
cost
We'll
of
pretend that's why I was waiting.
So the health department has a flu vaccine. There's a lot of clinics that will have free flu vaccine days. So just exploring the resources in your community and looking around, and it's really affordable when you look at the protection that's extended by not just vaccinating yourself, but it protects all the people around you. That the only way that infants less than 6 months of age are protected is to have people around them vaccinated. So you're not just doing it for you, you're doing it for everybody around you.
So what would, say Sam walks into work just looking terrible, and say it's just not like his regular Monday, but he actually might possibly have the flu. What do you, other than telling him to go home or go see a doctor, what do I do? My office is right next door, and I don't want the flu.
First of all, you said the right thing. Send Sam home or to his healthcare provider.
Go on.
But for you, obviously, you want to have good hand washing. And even the person with influenza should have good hand washing. So you want to wash your hands. You want to avoid touching your eyes or your nose, your mouth. Wiping down surfaces with a diluted bleach water, like a 1-to-10 ratio, is enough to help prevent the spread of the virus.
Is flu airborne?
It is.
Like,
So
it
it is considered droplet. So droplet is suspended in the air in about a 3-foot radius of the person, as well as when it drops, it hits the surface and it will stay on that surface alive for a while.
3 feet.
Yeah. So coughing, laughing, sneezing.
Well, we did a sneezing video here at the HSC a while back, and I mean, even somebody covered their arms, their sneeze spray, as gross as it sounds, was still 5 to 6 feet.
Yeah.
That's incredible.
Just thinking of children in schools, the desks are so close together.
Oh, schools are they're just germ pools. They really are. Oh, kid germs. That's something else we can talk about another time, because man, they're mutants. That's what they are. They're awful.
They're just building their immune systems.
Well, but it's like my kid gets sick and he comes home with a virus, and he's just like, and then I get it and I'm sick for like 2 weeks.
So just to recap, what kind of vaccines are out there?
So there's the traditional quadrivalent influenza vaccine. It covers 2 strands of A and 2 strands of B, and all of the vaccines actually this year are quadrivalent and cover 2 A's and 2 B's. If for patients that are age 65 and older, there's a high dose vaccine that's recommended for the older adults, and Medicare covers it. It is more effective for those who are older because of their immune systems. And so that's recommended for that age range. For many years, people thought if they had an egg allergy, they could not get the flu vaccine. But there is a vaccine that is not grown in egg medium. It's the recombinant influenza vaccine. So that's an option available for those with egg allergy.
Okay, well, I think we pretty much talked about everything.
Yeah, this has been super interesting. I really appreciate the time.
No, thanks.
Yeah, thank you for coming over.
It's an important topic, and I really appreciate the fact that you're covering it.
Sure. No, it's I think it's the biggest health crisis every year that's recurring. I mean, with the exception of the bigger ones on topic, but I think it's serious, and people die from it every year. Kids die from it. 56,000 people. That's terrifying.
Yeah, and it can be prevented. It's preventable deaths with vaccination, and there are some people in our communities that absolutely cannot be vaccinated, and so by everyone else getting vaccinated, it helps protect them.
Okay, I guess I'll get mine.
Thanks, Mary Lee.
Hey, thank you, Dr. Weston, for being here.
Yes, thank you.
Thank you.
Thank you for joining us on Texas A&M Health Talk, a production of the Texas A&M University Health Science Center. Visit us on the web at vitalrecord.tamhsc.edu, where you'll find answers to all of your health questions. Until next time, stay healthy.